So to help you maintain the health of your teeth and gums, we suggest that you follow the following oral hygiene routines daily. First of all, we need you to be flossing, and second of all, we need you to be brushing. You'll need a soft bristle toothbrush, some toothpaste, and some string floss. Floss can come in the string type, or it can come as a dental tape that we've got here, or you can have other floss tools that you can use to clean in between the teeth, and we'll talk about them at another time. Firstly, we'd like to get you flossing. It's important that you do that before you brush. With the floss, you'll need to take a 30cm string and wrap it around your middle fingers like so, and then grab onto it with your pointer fingers and your thumbs, much like you'd grab onto a sandwich if you're going to take a bite out of it. What you'll need to do is bring the floss in between the teeth, underneath the contact, the point where the two teeth meet. You'll need to wrap the floss or adapt it to the shape of the tooth, and we often say you're wrapping it around like a C shape around the tooth. And then you need to slide it back and forward very gently, like you're polishing shoes, very gentle motion, underneath a little triangle of gum that sits in between the two teeth. And then what you need to do is just gently wriggle it back and forward out along the side of the tooth. Once you've done that, you can do the tooth next door to it. It's very important that you have the floss adapted to the shape of the tooth, because if you don't and you have it straight and you just drag it up in between the point where the teeth meet, then you can tear the gums. So very, very important that you have it wrapped around the shape of the tooth. Sometimes when people floss, they notice that there's bleeding. And if you do notice that there's bleeding, make sure that you talk to this with your dental practitioner the next time that you see them. If you do notice some bleeding, make sure that you continue to floss and that you don't avoid flossing. Because if you stop flossing altogether and you leave plaque there, this can cause more gum problems. After you've flossed, it's important for you to brush. So what we want you to do is to hold the brush and angle it at 45 degrees towards the top teeth. And this way the bristles are facing the tooth and the gum at that angle. Then what you need to do is move the toothbrush around in a circular motion, and this is going to remove the plaque off the tooth surface and around from the gum. This prevents you from scrubbing over the gum, which can cause unnecessary wear upon the teeth and gum area. Once you've done the outside surfaces, you can go around and do the inside surfaces. When you do the inside surface of the teeth, again, you'll need to adapt the toothbrush to a 45-degree angle, moving it around in a circular motion. And after you've done all of the outside surfaces and the inside surfaces, you can move to the bottom teeth. After you've done the bottom teeth, what we'll need you to do is to lastly scrub the biting surfaces. And you can give them a back and forward scrub to complete your brushing and flossing. It's very important that you brush and floss twice daily, in the morning, after breakfast, and in the evening before you go to bed.